good morning, good afternoon, good evening, everybody, and welcome to the second session of this year's annual forum of the Scaling Community of Practice. For those of you who may be new to our membership, we want you to know that this is a group, you're joining a wonderful group of 5,000 people who hail from 127 countries, some 1,300 organizations, united by perhaps just one major concept, which is that we can do better at trying to bring important outcomes to scale and keeping them there in the places that need them most. We've been dedicated to that proposition for 11 years, and we try to renew that dedication again today. Today's session is going to be a super fast moving session. I'll give you just a sense of the arc of the session. We're going to start out with a quick executive briefing by me of sort of where we are in the process of both the scaling activity and the scaling campaign. And then we're going to bridge very quickly to what you might call a deep dive on some of the issues. It's going to take an interview format with three extremely knowledgeable interviewees being interviewed by Alan Robbins from DevX. We're then going to go into a third piece of the agenda, which focuses very much on a specific example of what this kind of change looks like in practice. And we're going to end with the last 5 minutes, which I would say in this particular session are the most important 5 minutes, where we're going to try to systematically get some feedback from you that's going to feed into what we feed back to you on the last day of this forum, which will be next Friday, and the way we go forward as a community. If that's a little bit confusing, I promise you it'll get clear as we go along, but we've got a lot to do in a short period of time. Fasten your seatbelts, get ready to go. Here we go. All right, let me put this in the context, if I could, of a 15-year journey of this community of practice. If we started back about 11 years ago, we started with what we're calling phase one. And that was, I think I can say, the purest community of practice I've ever been part of. We were a group of people, all of whom were learning together, all of whom were sharing together. No money changed hands. There was no secretariat. It was simply a group of people trying to build a foundation on what it meant to scale things effectively. And that took the form of trying to link us to one to another and do the best and the most systematic sharing we could organize in a very informal, organic way. Call that phase one. Phase two, built on the backs of phase one, tried to continue the best of what was happening in phase one. And for the next 5 years, we tried our best to fill in where we thought we saw important gaps in our collective knowledge. So we tried to develop and disseminate new information, new approaches, and we tried as much as we could to promote and define what it really meant to bring a scaling mindset to this kind of work. Where we are right now is in that arrow that connects phases 1 and 2 to phase 3. And you could call that an arrow of ambition, because the arrow of ambition basically says what we want now is nothing short of trying to create a tipping point in the community, beginning with host country governments, including funders, implementers, researchers, such that the concept of scale and scaling is not at the periphery, but at the center of everything we do. And today's conversation, and I hope everything that follows, is really built on that proposition. So let me try to fill in some of the gaps for you. As a starting point for this, we tried to look at the behavior of funders. Why funders, you might ask? Well, for two reasons. One, because we felt that funders had the ability to be catalytic in some aspects of this. And secondly, because if there was not movement on the funder side, we felt there was a real danger that it would inadvertently, and that it was inadvertently, acting as a retardant, holding back what was possible in scaling. So to try to test that, we looked deeply at 28 different funding organizations. 28 different funding organizations. That included 3 multilateral development banks. It included 3 bilateral agencies, 8 foundations, 6 innovation and research funders, 6 vertical funds, and 2 NGOs. You'll see their names and their logos on the screen. And throughout all of that, we are asking the same question, which is, what is it that they're doing, and what is it that they wish they were doing, and what is it that they could be doing that would help them be more faithful and more consistent supporters of the achievement of sustainable outcomes in the field, recognizing that's not a funder problem, it's an implementer and a host country problem, but funders make a difference. So we took a deep look at those funders. Almost all of those case studies are now published on our website. Honestly, if you want to get a real feel for this, pick up 1, 2, 3 of those that really speak to your own circumstance and read them. They give a level of color and a level of depth that's impossible to capture in synthesis reports or in the remarks I'm about to make. Alongside that, we did a whole series of what you might call collateral cross-cutting studies. We did a study of recipient perspectives. What does it look like on the receiving end? We did a study on the relationship between scaling and localization. We did one on country platforms. We developed a tracker tool that funders and others could use to see the extent to which scaling considerations were incorporated into what they did. We looked particularly at the evaluation methodologies and whether they were helping or hurting. We did deep dives in a couple of sectors, and we helped to inform the scaling guidance that was developed by OECD DAC for use by bilateral donors. We had a chance to do a range of consultations in a variety of places around these issues, and very recently we were finally able to publish a synthesis report and a policy brief based on all of this information. If you haven't had a chance to see those documents, we really hope you will take a look at them. Johannes Lynn yesterday had a chance to preview some of those things. Another way to get a kind of a bird's eye view, if you weren't there yesterday, would be to go back and look at the video from yesterday's presentation. So one of the main things that comes out in all of this work is an important distinction between what we now call transactional and transformational scaling. You could think of transactional scaling as being the notion that all we need to do is bigger projects. If we could just crowd in more development finance, that would be what scaling looks like. More direct beneficiaries, bigger projects, more places. We came to a view that's not the scaling we're talking about. The scaling we're talking about is fundamental and permanent change in local systems, in the way goods and services are delivered, in the way outcomes are achieved. And that's got certain features. You'll see them in the bullets that we're highlighting here. But one of them, perhaps most important, is to think about scaling and sustainability from the beginning, not at the end. The proposition is not, we will do a pilot project. If it's successful, we'll start to think about scaling. Our observation has been that if you do it that way, by the time you get to scaling, you're too far down the line to make the changes necessary to really implant embedded change. We also learned that this process is not short. It's 10 to 15 years, which almost always succeeds the lifespan of a given project. So any project somewhere along that pathway has got to be mindful of where it is in the pathway, how it relates to what came before and to what's going to come after. Easily said, not easily done. Next, we believe that requires a phased approach and a real sense that there are many actors simultaneously involved. It's more like urban development than like building a bridge. We learned that if you're really at the early stages of this, a lot of attention needs to go into what might be called the preconditions for scaling. Not so much how many people do we reach, but how far have we gotten into creating the conditions on the ground that's going to make permanent change possible. And finally, that financial and implementation sustainability and capacity are central to this. What Kevin Starr from Malaga was called the doers and the funders at scale. Who will be delivering this if it's to be delivered at scale, and how and who will be funding it if it's going to be delivered at scale? This to us is a fundamental shift in the concept of scaling, but also has very practical implications, not just for funders, but for all of us involved in any aspect of development and climate action. So in turning to what that implies, what do we need to do differently? First and foremost, it's to keep that concept of transformational scale firmly in our minds as the true north of what we're trying to do. That in turn, from the funder's point of view, means a real realignment of internal systems and incentives to move away from direct accountability for projects to contributing toward these larger changes. And if you read the individual case studies, you'll see lots of examples of how people have tried to do this in practice. Third, and fundamentally, it means this is almost always in partnership. It's not scaling up your intervention. It's trying to scale up a desirable outcome, which means a variety of players have roles to play in this, and that at some point, it will only work if the predominant players, those who will be the doers and the funders at scale, feel and take primary responsibility for moving this forward. And finally, and perhaps more narrowly, we came to believe that the monitoring, evaluation, accountability, and learning systems have a great capacity to drive this process, or in the worst case, to get in the way of going where we need to go. So all of that led us to what we're now calling a campaign. This is moving from phases 1 and 2 to phase 3, if you recall my first slide. And the scaling campaign, again, is pushing for a tipping point in the whole range of actors that are involved in this. So at this point, we're no longer talking just to ourselves, we're trying to talk to the larger community. And we see 3 important outcomes. First, that these practices are articulated and adopted in whatever way makes most sense by all of the key actors involved in the process. The second is that we, more than ever, stay together as a connected and capable global community working on these issues. And finally, that we have demonstrations on the ground that people can see and touch that really show that this makes a material difference. That means in terms of our own internal organization, we need to move from being a network, something which is loosely structured and entirely or mostly voluntary, to a movement which still involves lots of locus of action, but probably does not have the same kind of a vertical structure or the same kind of loose organization that a network has. And we've begun trying to think about that. It's there that we really need your help. So we think there are at least 3 organizational options for that movement. The first is with a dedicated secretariat. We think for a variety of reasons I'll mention in a second, that's the best of the available options. It may not be an available option. An alternative, which we think also has virtues, is what you might call a dispersed secretariat, which is that a number of the functions of this movement are spread out and exercised by a variety of different organizations, actors, and institutions, sometimes coalitions. And finally, we think there's a possibility that there is no center, that this is simply an organic and voluntary effort with no secretariat. We think in terms of likely efficacy, there's benefit to the dedicated secretariat. We think it can function with a dispersed secretariat, and we think we can make progress, albeit less certainly, with the organic and voluntary approach. That brings us to the scaling community of practice. So if you look at, well, what do we bring to this campaign? I would say it's that circle of things outside, which is most fundamentally the network of 5,000 of us from 127 countries and 1,300 organizations, really committed to and increasingly knowledgeable about scaling. That also includes the proposition of 9 working groups, which we have now very functional within the community of practice, which could presumably continue to operate and grow without the community of practice as a containing structure, but right now operate within the community of practice. We've got, as a community now, a track record of thought leadership and a lot of products, tools, and approaches. I think personally, very importantly, we have a reputation for independence. They're funders, implementers, academics, host country government officials. We basically don't have a dog in the fight about what it is that's being scaled or even the scaling approach in a given country, but we do have a dog in the fight about having that be as systematic, organized, and productive as possible. We've got a knowledge base. We think, a good high-level support system in an advisory group and an executive committee that are broad and deep. And we have a financial track record. There's a small secretariat that's been running this. You've met them either virtually or actually. over time. So that's what we think we bring to it. That, however, is predicated on being able to find some resources to maintain that secretariat. And the truth is, we don't know if we're going to be able to do that. So what we're hoping is that you all will help us both decide on the desirability of that, if it is desirable, to try to find some resources for it. If it's not, try to figure out how we can sustain and deepen these various sorts of capabilities in a way that really drives the process of a movement that needs probably some level of support institutionally in order to be successful, but which really needs the actions of all of us to be successful. Finally, we think, however this goes, it's not a hierarchical organization. Even if that were possible, it wouldn't be desirable. Movement is the right word for this. And we think that means there need to be a lot of players. So we're taking a first step on that as the scaling community of practice by trying to identify a limited number of organizations that we really know get it, who are doing this work every day in the field. And our vision of this is that as work proceeds, and I'll later in today's session, I'll give you a good example of what this looks like. As work proceeds, it won't be the Secretariat doing the work. It will increasingly be a range of organizations. And if some of you on the phone or on the call seem to think that organization might be the organization you're part of, and we've not yet found you, please find us, because our intention is to try to build this out in as robust a way as we possibly can into something that really does look more like a movement and less like a traditional network or even like a traditional organization. So that leaves me to where we go from here. And to do that, we're going to try and bring the voices of several people who I know have been central to this from day one and who have very different, but I think very deep perspectives to share. I'm going to invite Alan Robbins from DevEx to come on screen along with the panelists who he'll introduce briefly, and I'm going to go away. I'll see you again in a little while. Thanks, Alan, and thanks everyone. Thanks, Jordan, Poonam, and I don't yet see Ndidi, but here I go.
Thank you so much, Larry. It's great to be here. And I just wanted to, I think that I want to thank you for having me here, and then also everyone else for joining. One thing I really like about what you were talking about, Larry, is how to scale. You were basically talking about how to scale this scaling community of practice. And I enjoyed that you didn't pretend to have all the answers, but importantly, you looked at all the various possibilities. So you're looking at the possibilities, and then you can get to those answers sort of as you progress. This concept of scaling, and sometimes it's called something different. This concept of scaling has been around for a long time. We started DevEx 25 years ago. I've been in this space, for 25 years. Larry, you've been in it for longer. You mentioned 15 years for this initiative. And, everyone's been talking about scaling or something similar in that time. And I do like that frame of transactional versus transformational. And because I think it goes into, during that 25 years, we had, development was really on the ascendant. You had increasing funding, you had increasing political consensus. And so, it was difficult. People wanted to think about scaling, but it was difficult to do that because there was so much to do. And, thinking about this individual project and this individual community and all the great work that you can do. So in some ways, the lack of real focus on it kind of makes sense in a way. We all know that this consensus has changed, certainly within the last year, but I think it was changing even before that. We had, in the US, the last year has been a big one, but even before that, you saw the UK and other sort of European governments spending less in this space. So I think that, it's a really important conversation now, because now is the time. We've always said we want to do more with less, but now is the time when I think it actually has to happen. So we've got a great panel to help us dig into some of these issues today. We have some top leaders in the global development space. First, we have Ndidi Okonkwo-Nwuneli, who's the CEO of the One Campaign, Poonam Mutreja from the Population Foundation of India, and Jordan Fabianski from Integral, which is part of the Dahlberg sort of group of companies and organizations. They've all had various, very varied and senior and important careers, and we'll get into some of the past as well, because a lot of their perspectives will come from that work over the years, which haven't always been with the organizations that they're with now. So let's zoom out a little bit. We'll talk some more about some of these bigger issues. And Ndidi, I'll start with you, if you don't mind. I spoke about the sort of the past 25 years that DevX has been around. One has been around for, I think, 2004 it started. And when you talk about that, what I call the ascendant period of global development, one is really a big part of that. When you look at the increased funding, the increased political consensus, one was there. I mean, there's very few organizations that can claim to have more of a role to play in that than one. However, I'll bet you would be the first one to say that model wasn't perfect. And that model, in some ways, probably needed some breaking. So let me just start with you and ask, what do you think was most, or is maybe most in need of breaking in that model? And what are some ways that we can do things better now that we're kind of forced to do things in a different way?
Thank you so much, Alan. And thanks to Larry and Johannes for continuing this vision and really galvanizing us from all over the world to join in this vision. To respond to your question, I'll say there are three things. The first one is who was driving the agenda, who was scaling, and who was receiving and benefiting from the scaling. And I think a big mistake that our sector made and struggles with today is the concept of power, transfer of power, knowledge, data, and innovation to local communities. If we take PEPFAR as an example, it scaled, right? In terms of innovation, $10,000 to treat someone with HIV down to $42, right? $25 in some concepts. That was amazing. 26 million lives saved. But the challenge was the pathway to sustainability and shifting ownership to the countries, responsibility to the countries, and gradually working our way out of our jobs. And so for me, a big wake-up call is that as we scale, we need the beneficiaries, the partners to own it, and there needs to be an end date to where we pass on that responsibility to them. The second concept and the issue that we continue to struggle with is smart investments and using money efficiently and effectively to deliver impact. And I think when we see what has happened with the cuts, we recognize that oftentimes our sector gets very complacent where there's a lot of resources. And so efficiency and effectiveness, the lowest cost approach to delivering impact, smart investments using innovation and technology is critical. And that is a key lesson. And I believe the scaling community recognizes the importance of data-driven, technology-driven, low-cost scaling. And as a sector, we must embrace that. And the third is this issue I often talk about, where it's about attribution, who gets the credit, the importance of leaving our egos and logos at the door and scaling what works, not our work. In our sector, the competition has been fierce. And oftentimes, everyone wants to take the credit for the same results. And the importance of saying we're putting scaling what works, not our work, at the forefront and really gumming together as a sector to understand our failures, our successes, and collaboratively working to scale impact, for me, is a key lesson. And I think one that this community of practice has to embrace to deliver impact.
Mm-hmm. Yeah, it's interesting. I've heard from many and spoken with many African leaders, sort of both publicly and privately, who, sort of the general view I get is they say, we wish this hadn't happened the way it happened, the way that the development funding being, sort of going down dramatically, global health funding going down dramatically, but it had to happen. Is that what you are hearing as well, or is that the general gist that you get?
Definitely, it's a wake-up call for many in the ecosystem, and we see African leaders stepping up to say we must define the future that we deserve for our people. The way that it happened was cruel and unnecessary, But that pathway to sustainability is critical and necessary. And I think as a scaling community, we must embrace the ownership and the responsibility and the accountability that African governments must step up to deliver for their people. At One, we've laid out a very ambitious pathway to sustainability with health financing. And our hope is that by 2035, at least 50% of those who live in the African continent will live in countries that can fully finance their own healthcare, while ensuring that we reduce under 5 mortality, reduce poverty by 50%, and ensure that out-of-pocket expenses is down to 20%. So having clear North Star goals with ownership, responsibility, data, and impact at the core of this is key to the future we must create together.
Great. And Poonam, let me move over to you for a second here. If you look at a kind of a laboratory for scaling, I think India is probably one of the most important ones out there. And, you have India's, I've heard it called sort of the land of 1,000 pilots, where you have all these like little programs that are happening. And so scaling comes across to me as being very important in a place like India. And I think that part of it is a convincing game where so many people are really interested in the innovations. Like there's so many cool innovations, the new cook stove, the new toilet, and they're all really important. But the scaling is the thing that could kind of bring it all together and really lift it up. How do you see it from your, I know that you're now with the Population Foundation of India, you're with the MacArthur Foundation before that. What do you see as the challenges and the opportunities in India specifically in bringing about scaling?
Thank you, Alan. I'm delighted to be here, and this is a great conversation that we've been put together by Larry and Johannes. So first of all, if I want to say something to your saying India is a land of 1,000 pilots. Having worked for 50 years in the development sector, which of course dates me, but I call it the land which is a junkyard for pilots. And when I'm feeling more pessimistic, which is very rare, I will say it's a graveyard of pilots. So India has had the opportunity, because we not only have the numbers, but we have some kind of fiscal stability. We've had a lot of donors in India. India is a place where donors have always flocked and enjoyed pilots, enjoyed scale, and India is a country to learn from for scaling up, because we have taken a lot of programs in spite of the junkyard to scale. So I would say the environment today is where our government is looking at our country as the new economic superpower in the years to come. So policymakers and political commitment plays a major role. And I do believe there are opportunities, but the challenges are for policymakers rarely can be persuaded with theoretical arguments. So this practice of community and what we're discussing is very important for India today. They respond to three things. One is, of course, political buy-in, which is not just in India, I'm sure in other places, fiscal feasibility, and delivery certainty. The case of systematic investments needs to be framed sort of in those terms broadly, but there is much more. And global and Indian experience shows that while many innovations demonstrate success in pilot settings, very few translate into large-scale impact. And I think that should not discourage us. We have to learn from what hasn't worked much more from what has worked, what has gone to scale. A common assumption has been that once an innovation works, scale will follow naturally. That is something as I grew up in the NGO sector, starting in my 20s, I have to say that, people assume, just as governments did, just as donors did, that there'll be an automatic, natural expansion. That time we used to say expansion. Scale up is a little more sophisticated compared to when I started out. So a common assumption then has been that innovations can work and scale up naturally. But in practice, scaling requires, I believe, based on not just my experience, but observations and what I've learned in the community of practice, is clearly that scaling requires deliberate investments in systems, planning, institutional capacity, and financing. Without these, even promising innovations fail to deliver at the ground level. And again, based on our experience, we saw that organizations running successful pilots were not always equipped to manage the complexities of scale. This highlighted the need for a credible intermediary, which is a role that I see the community practice going in the direction, as Larry said, advocacy and convening power across governments and donors is key there. And that role was taken up by the Population Foundation of India to support the scaling process. And I think the best investment India got was a partnership between the Population Foundation of India and the Management Systems International, which Larry founded and led, to apply a scaling up management framework, simplifying models, and strengthening scale readiness. Scale readiness is something I want to underscore again. This was developed specially for India and has supported NGOs and government innovations across India, training 500 senior leaders and mentoring multiple pilots. And, I would recommend highly, without your asking me, that this is a framework with secretariat or no secretariat that should be developed for much of Africa, if not the rest of the world. And, champions matter a lot. You need champions who can successfully scale up which is often driven by individuals who believe in the model, can mobilize coalitions and navigate the political process. There is more politics in scaling up than we imagine.
I'm fascinated that, all of these things, India is positioned to be, and not every country has this, it's positioned where it does have a lot of domestic resources. So you have a very functioning government and everything, and it can invest in these things. And, it gets to the question of, some countries is more donor oriented, and India has a real opportunity to take the lead in these pieces. Jordan, if I can just move over to you for a second here. So Dahlberg, has been working, and Integral, which is part of sort of the Dahlberg umbrella, is working with sort of the key development players on figuring out how to get the most out of their investments. Now, I guess sometimes maybe that's monetary, but for the most part, it's impact. And so, as we've discussed in this old model, most of those projects, or many of those projects, were transactional. I think, Nandini, you had a great sort of refuting my point about I do agree that PEPFAR was in many ways scaled, but many of them were transactional, and you're helping a community solve a particular problem. And I think for the investors, and when I say investors, I mean foundations and donors, it was very well-meaning, because that was very easy to track. It was very easy to evaluate. We helped put this many people in school. We helped, bring medicines to this many people. And so, the scaling initiative is arguing for sort of a more transformational approach. How do you see investors, or how can investors and sort of other players in this be convinced to take that course, especially, considering a lot of their systems are set up to work in the old model of transactional approaches?
Yeah, no, thanks, Alan. This is a great conversation. Maybe I'm going to pick on the word convince, because I think there's some subtlety in there. I love the distinction between transactional and transformational, but just to name what we're really talking about is belief work, right? Like we're holding assumptions as development practitioners or funders of development and climate action, about the way scale can happen, about the way we can approach collective problem solving. And for a long time, and indeed he was pointing this out, unfortunately, funders especially wanted to believe that we could take a transactional approach, or that we could accomplish our objectives without, say, truly co-creating with the host country governments and community stakeholders and others, when that takes a lot of work, and that also takes a lot of time. And so there is this sort of built-in bias, wanting to believe that we could accomplish our objectives with what's measurable, with, as you used the word, easy. It was a perception, but wasn't true, right? The sense that it would be easier if we just focused on a transactional approach. We're now in a moment of rupture, it's been described as, cruel dismantling of US aid and the unraveling of the finance architecture as we know it. Could not have happened in a worse way, and at the same time laid bare a lot of these suboptimal beliefs. And now there's an opportunity to ask, what is it that our partners, host country governments and their development partners, want to believe going forward? So what I'm hearing, I run a nonprofit that builds coalitions. We often facilitating flows of intelligence information, engaging with different stakeholders to ask what's the gap between what's happening and what needs to happen. And what we're hearing is that there's a desire to better honor country agency, to build trust and cooperation, to move beyond transactional coordination and more towards a model of collaboration where all kinds of actors, government, philanthropy, multilaterals, and others can contribute by leveraging their comparative strengths in concert, right? And there's a wanting to believe that we can accomplish more with less, but that also means that we have to work in a more joined up and integrated way. So all of that means that we need to embrace a more transformational approach to scaling. Now, maybe what I'll just say about the way forward is that, and this comes back to the word convincing, as you know, it's very hard to just change someone's beliefs. You try to shift what people believe and it tends to backfire. Small amounts of disconfirmatory information tend to make people angry, right? And what's interesting right now is that there is a new emerging desire to believe something different. And if we listen, there's a chance to shape a narrative of scaling that is grounded in what our partners are calling for, rather than push something onto them. And I think that's where the mainstreaming campaign effort is really onto something. There's an opportunity to be good listeners and to provide a kind of narrative infrastructure whereby transformational scaling work and approaches can be taken up in different contexts and grounded in language and practices, in use cases that resonate with those closest to those contexts. And so I think that's where we now have an opportunity to install that infrastructure. And I'll pause there.
Yeah, and what I'm hearing from you and others is that in the old model there was, and it still happens to a degree. It's not like everything changed overnight, but a lot is changing. But in the old model, you would have sort of the donor who was kind of the owner of the project. Let's say there was obviously a treaty and everything that was working with the local government. But let's say the donor, let's say USAID was owning the project, and then at a certain point, the idea was that okay, we've done this for so long, we've gotten it so this big, and we're going to pass it off to the local government, and they can take it from here. That was kind of the concept at the time. I think what I'm hearing from you all is that handoff never happens, or it should never happen, in the sense that that should be the start. Yeah, at the start, it should be the local government. Others should support it. The donor should never own the project. How is that coming along? Is that making an impression, and is that really happening?
So I love the use of the word ownership. And, Poonam alluded to this, that in India, you described it as a junkyard or graveyard of pilots. I'm going to post it in the chat because it was just reminded me of this terrific recent SSIR article where a tech firm mined 100,000 USAID evaluations over 80 years for the common key insights. And one of them was that too many pilots were never really designed for scale. And many pilots failed not because they were bad ideas, but because nobody owned them. And if you really get under the hood of the word transformational, ownership is the ground of transformation. And if we don't get that right, then what are we really talking about? And I think going forward, there's an opportunity now to rethink how ownership can be baked in from the start, how strategies for scaling can be locally owned, country owned, collectively owned. And that is going to require some openness to engaging with partners in different ways, some creativity in how we structure governance. And I'm seeing that start to take shape. We're certainly seeing our funding partners more open than ever to embracing a collaborative approach that rebalances power. So I'm encouraged. I think if we'd be remiss if we didn't take advantage of this moment and learn from some of these lessons from 100,000 US state evaluations of things that worked well or less well. But all to say, I'm optimistic that we could pivot to a better path.
Right. Okay, great. And Poonam, I'll go back to you for a second here, which is, we were talking about the India context and sort of ownership. And so, at the end of the day, how do we make this from a conceptual, aspirational thing to where people in the organizations themselves, I'm not even just talking the development organization, I'm talking local government, local NGOs, people in those organizations themselves are incentivized to not only care about their day jobs or their day-to-day jobs, which is, it might be to help health outcomes in a community or whatever it might be. There was something like 15% of everyone's time was supposed to be spent looking at big picture things. I don't know how that works, but I remember it was a thing at the time. But yeah, basically, most of the benefits, most of the activities will be done by people actually working day to day. They won't be done by the policymakers. They won't be done by the CEOs. How do we get those individuals to really care about these long-term issues?
Yeah, so, to build scale into the delivery structure, using existing government systems that these folks work within is very important. Simplifying pilots from them. You can't go with a very sophisticated framework and expect them, and you have to totally understand and own it. Fiscal viability is something they do have to be told that there is money in the project implementation plans and budgets and so, and they have to feel secure about early inclusion in public spaces. And cost effectiveness is another thing because, however much money there may be for infrastructure, bridges, various things, but for development, what we are talking about, cost effectiveness is important, not only because the international world, there is a funding or financial crisis, but also, institutions within countries, including India, given where we are economically, but we have very little, we keep cutting budgets still for education, for health. I mean, in a situation, let me give you an example which is shocking. Delhi is the most polluted city, and we saw a 40% cut in our budgets for pollution. Okay, part it's politics, parts it's not being able to use, but that's not the subject of the discussion today. So aligning incentives, the second would be that the incentives for the implementers have to focus on what they are measured and rewarded for. And they are rewarded for scale, not innovation necessarily. Embedding scale in the metrics, replicability, institutional adoption, cost per beneficiaries. These are things that give them local leadership visibility. You have to give them mentoring roles, and policy engagement further reinforces the long-term ownership. But I have found in all that we have scaled up, Alan, you cannot do it without the engagement, involvement, and incentivizing the people who work at the district level. You can make great plans at the national level, whether it's donors or governments, state level. The action really is at the district level. So PFI as a strategy has started aligning more while we do our advocacy and buy-in at the national and state level. We invest a lot in the people who are the implementers, the chief medical officers, the frontline health workers, and we build a coalition literally with them, and we give them incentives that can be recognized by their superiors. And institutionalizing it within the government system is very important. You cannot bring outside institutions and put them to deliver. For example, Population Foundation of India supported the expansion of a community action program for health from 1,600 villages in 2008 to 230,000 villages across 25 states. India's a large country, right? But we did it by 2023 by simplifying the processes, which is what I was alluding to earlier. You need to simplify. You can't give them a complex framework. Processes and strengthening state ownership and ownership at the local level. Clear scaling pathways are a great change and incentive. It's a pathway change, sorry, and it gives them incentive because implementers see a trajectory for efforts to lasting system level impact because they know what the community needs. And unlike our political leaders and high level bureaucracy, they move from one place to the other. But these guys don't. So there is a fidelity or ownership, there is a commitment because they come from the same community, the same villages, and they're going to live there. And finally, a second example I just want to quickly use of what we did, and in 2 sentences, I'll capture it. India's entertainment education initiative, one of the biggest, has been I, a Woman Can Achieve Anything, 180 episodes for 3 seasons on television. We reached 150 million viewers on television and hundreds and millions of people digitally. You know how we did it? We made it free for Government of India's TV program. And it reaches the media dark areas because, of reasons where people can't invest in the paid for cables, etc. And this demonstrated that when scaling pathways are clear and supported, implementers are far more invested in long-term outcomes, and also they get the credit. It was a Doordarshan of India, Government of India's program, and we made sure the donors did not own it. Donors did not they got credit. They got credit at every episode, at the end of every episode, but not for the entire program. It was owned by Government of India. And so this, as I said, demonstrates scaling pathways are clear and supported. Implementers are far more invested in long-term scaling up. And finally,
let me just pause you there because we are getting close to having to. Yeah. Larry's going to give me the hook here and drag me off stage in a minute. I just want to move over to you, Ndidi, and maybe get some final thoughts to you. And after this, everyone's convinced, transformational scaling is the way to go. What do you see as the biggest possible blockers to it, and how might we overcome those blockers? And again, we are running out of time, so it's a big question for a short answer, but just want to kind of get some ideas for what's next from you.
Thank you so much, Alan, and I agree with the 2 previous speakers and want to kind of double tap on all their comments. I would say 2 things. One is we should not fall into this trap of a zero-sum game, and that's why advocacy is so important. How do we communicate what we're doing to everyone so that they can see themselves in that future? Why we face backlash and people come against impact of scaling is that they don't see themselves in their future. I've literally had people, Alan, ask me, if Africa gets its act together, I'm not going to have a job. I'm like, you could have a different job, not just this job. So growing the pie and painting the narrative to taxpayers in America, what are they getting out of this scaling effort? To taxpayers in Nigeria, what are they getting out of this effort? Advocacy, communications is critical. And if we do not have an advocacy agenda coupled with the comms agenda, where we are showing the benefit of a greater improved pie for everyone and really minimizing the sense of loss, we'll continue to face opposition. And so that win-win is key. The second, and I want to, with all due respect to Poonam, I'm hearing a lot of people saying things are working in India. Let's bring them to Nigeria. Let's bring them to Kenya. It's not one size fits all, okay? And we need to, while the South cooperation is very important, and I applaud it, we can learn a lot, but we cannot replicate hook, line, and sinker what has worked in one region, even on the continent, and expect it to work in another. The same listening, the same design principles on the ground, the same ownership on the ground is critical. And so as a community, we have to keep that in mind, because otherwise we risk creating a new type of power dynamic that is unhealthy. And at one, we are seeing so much promise and innovation coming out of the continent, and a lot of excitement around the Accra agenda, the need for sovereignty and solidarity, the need for innovation. And through our work, we're piloting and scaling, diaspora health insurance mechanisms called Health Bridge, and seeing so much excitement. And in each context, when listening on the ground, we're designing, we're creating political will, we're finding local partners and local funders, we're learning from what has worked in other places, but we're saying we must do things differently. I just want to sound the alarm on those: advocacy, communication, and continue to pilot and scale on the ground, putting the needs of those who you're trying to serve as at the forefront and working yourselves out of the job.
Great. Well, thank you so much indeed. And thank you to Jordan and Poonam as well. I thought it was a great conversation. We could go on for another hour on this, but we won't. And we'll pass it on to Larry for just to close up this little session. I think transition us to the next session. So Larry, I'll pass it back to you.
Thank you on behalf of all of us. That was a really not only stimulating, but a really inspiring conversation. I'll say just a word or two by way of transition from that discussion to where we're going next. A lot of the conversation is about why this is important and what it's going to take to try to convince people of that. I'm personally of the belief that a big part of it is for people to believe that it's possible, that what we're asking them to do is not to be a foot taller, not to do something that's outside their range, but to do something that's not only going to be important in terms of outcomes, but feasible in terms of process. And for that, it's critical to learn by example. And it's also critical that we have as much diversity in the conversation as possible, because there are a range of institutional perspectives and a range of contexts. One of the things we learned absolutely from the 28 case studies was that there were untold stories, for example, about the role private foundations or vertical funds or innovation funders could play in this, that don't necessarily apply equally and across the board, but they apply fundamentally to classes of organizations. So this next piece of the agenda, we want to try and showcase what this might look like in practice. And to introduce this, I'm going to put up just one slide to tell you how the community of practice has been framing this. In our view, in addition to advocacy and learning and so on, it's very important that we have proof points on the ground. And we're calling those proof points initiatives. We've got a total of 16 of them. We'll put it in the chat right now, the listing of that 16, but they fall into these 5 categories. These are things where there are current constituencies able and willing to solve practical problems, but that help to make the point more generally about what we do, how we do it, and that it's possible. And we want to illustrate that today with one of those initiatives. The initiative happens to be funded by the Rockefeller Foundation and is overseen by Simon Winter. Simon, hi. So Simon is no stranger to this community of practice. He's been absolutely instrumental in getting us as far as we are. And he now is helping us yet again in a very different capacity as a vice president at Rockefeller. I'm going to ask Simon in just a second to talk about one of these initiatives, one that we've already embarked upon, and he's going to be joined by Abdi Hakim Ainki from the government of Somalia, who's the partner, key actor in trying to move this thing forward. We're going to have a little discussion between the two of them and me about this initiative, but for those of you listening, here's how I want you to think about this. This is an example of an initiative that we think could take place under a campaign like the one we're proposing, and which not only benefits itself, but benefits the larger campaign. Simon, why don't you tell us a little bit about this initiative?
Yes, thanks, Larry. Greetings, everybody. Actually, I work for RF Catalytic Capital, which is a public charity funded by Rockefeller Foundation. So the funding is flowing from Rockefeller into RFCC, as we call it. And RFCC is hosting something called Build the Shared Future, which is an initiative that not only includes my initiative, which I'll explain in a moment, but also looks at the moment we're in from a perspective of what needs to happen next in international cooperation and development financing and funding. It's also looking at health systems from a global public health perspective, and it's also looking at climate from the narratives of climate to enable that to become more of a human-centered branding opportunity rather than something that tends to be more divisive, at least in some quarters. On the food one specifically, we are looking at how to take advantages of the crisis in traditional sources of development financing around the fact that there are now very significant advances in Earth observation technologies, in information coming from terrestrial sensors on soils, in water, the opportunity to run extremely low-cost surveys using mobile telephony and digital, and of course the advent of AI now as a way of taking multiple diverse foundational data sets and then producing information products that could be used for anticipatory action in advance of the next food crisis, but also to help plan and build more resilient infrastructure, services, business opportunities, farming opportunities for more resilient food production into the future. And that's really the core. So we're trying to bridge what has traditionally been very siloed and fragmented work under the humanitarian banner around food assistance across to what is more conventionally a development challenge around nutrition, around food, around agriculture, and also into climate adaptation and resilience, using data as the unlock. As we think about this, the scaling dimension for me as a devotee of many years of introducing scaling strategies at TechnoServe in my career there, at Syngenta Foundation during my tenure there, which is one of the 28 case studies, by the way, that has been mentioned already on this call. The importance of thinking about how to use more scarce resources much more cost effectively and much more efficiently to provoke system-level transformation and system-level change happens at two levels as we're thinking about it under our initiative. The initiative, by the way, is called Reimagining Humanitarian Nutrition Security. So at one level, it's about the data systems themselves. And I'll give you two small examples of the challenges that are being faced. Many of you will know that FuseNet, the Famine Early Warning System network, that's been supported by US government for 40 years, went dark for several months last year when USAID closed. It's now at State Department, but who knows for how long and how well it will be supported. And that's just one major platform data initiative of many. A second one is the World Food Program that has also been struggling with significant downturn in its funding, which has meant that the data it collects was reduced. Its data points were reduced by about 30% between 2024 and 2025. That's going to be reduced even further this year. And that, of course, means the quality, the timeliness, the reliability, the accuracy of that data is significantly impaired. So we need to think about scale on the data side, and to points that have come up already in the webinar, how do we get that data to be responsive to the needs of local stakeholders, government officials like Abdi Hakim, who we'll hear from momentarily, but also local farmers organizations, local SMEs who want to invest in more resilient agribusinesses, for example, and so on. So this whole data pillar and how we scale data access, data availability, data accuracy, and so on is absolutely critical for that piece. And then the second question is, at that local level, in fragile, conflict-affected states, fragile regions of much more stable countries, how do we prove a case that says that by investing in much more integrated and harmonized and more cost-effective data systems in response to local needs, that scaling can then happen in terms of real investments in those storage businesses, in those logistics businesses, in those irrigated farms and so on, that are going to be at the core of more resilient local food systems.
Simon, a dimension of this that you and I have not talked about before, but I'm interested in what you think about it, has to do with the sustainability of these changes within Somalia, for example. So you're supporting this financially, you meaning the fund, for a couple of years, maybe a bit longer. What's your vision for how that takes hold and gets sustained within Somalia?
So yes, your question is very apt, because the way that Rockefeller Foundation and RFCC are thinking about this Build the Shared Future initiative is it's a catalytic nudge as RFCC itself institutionally comes together. So what can be achieved in a relatively short time frame through the pilots that we're supporting in Somalia, also in Haiti, and planning to support in the Philippines, that's where it's absolutely essential that we build in scaling design principles, scale up principles in terms of the pathways of scaling for different elements of what we can start to promote through these pilots from day one. And as we think about that, there's going to be scaling on the data system side, as I mentioned before, which could be, and this is something we're supporting already in Somalia, the establishment, for example, of locally owned, locally run integrated dashboards that are much more open to use by diverse local stakeholders across from the public sector to the private sector to civil society and so on. And how do we then establish those dashboards in a way that themselves, those dashboards have their own sustainable financing models, business models, engagement with that wide array of stakeholders. So there's a, let's say, data system scaling component. And then as we think about the resilience investing in the businesses, the farms, et cetera, where does that financing come from? So that has to be part of what we do during this design phase. And the early stages of implementation of these pilots is then thinking about, well, where, who's going to be doing that investing? Where is that financing going to come from? And how do we create, let's say, the de-risking, onboarding, blended finance structures and so on that could enable then others to crowd in around that financing? In the Somalia case, it could be Somali diaspora, both supporting the dashboard and its emergency response capacities and capabilities for the current drought that's underway right now in Somalia, which is starting to wreak havoc in the country, but also having some of those remittances come into investing in local SMEs and farms and so on, and then bringing in the multilateral development banks like the World Bank, the African Development Bank in the case of Somalia, maybe the Islamic Development Bank and others, alongside then other DFIs and then private investors and philanthropists to create those blended finance stacks that can then be at the heart of scaling up those investments, beyond the 2 years or so of catalytic nudge that we can make.
Perfect. That's exactly the right cue for me to bring in Abdi Hakim. Thanks, Simon. Abdi Hakim, let's bring you on camera. First of all, thank you for joining us from far away on this call. For those of you who don't know Abdi Hakim, he is the Director of Food Security and Climate Change in the Prime Minister's Office of Somalia, where he's been in that position. He's been in 2024, but he came into it with, I would say, the perfect background from this as having been the co-lead and the director of Somalia's first innovation, entrepreneurship, and technology hub. So thank you for joining us and for talking about this. I'd like you to pick up the discussion exactly where Simon left it and tell me what this looks like from the Somali side. Why did you want this project? How do you imagine it's going to get funded? What problem do you think it's going to solve? What does scaling look like from your side?
Well, first of all, thank you so much. And it's an honor to be here with you and the rest of the colleagues and friends in the room. So I think the timing of the catalytic capital or the reimagining initiative by the Rockefeller Foundation was absolutely critical. I mean, it really came at a time when the global financial architecture has been slowing down and in many ways declining, that the ODA, the overseas development aid, has been on the downside, and a lot of countries for which Somalia was relying on has also been rapidly withdrawing, namely and primarily the US aid and the UK and whatnot. So here comes is the catalytic nudge that Simon talked about, and really ask ourselves, I mean, what can we do with a very small limited amount of resources and to see if we can pilot that to scale it up at a nationwide, a countrywide. So the very conversation that we have in the beginning was we came together thinking the idea of, okay, we will only have small catalytic ideas, maybe small resources. Can this be scaled up to the country? So our thinking in the beginning was informed for that. And what does it mean for scaling in our own context is more about really moving away from the silos and fragmented solutions that are scattered in many parts of the country. There are a number of development-led initiatives, some of them through the data system like FuseNet, and others through, the country humanitarian appeal fundings. Most of the attempts and infrastructures are siloed and disaggregated in the country. So what we thought of is, how can we really start thinking of an initiative? And this is exactly what the catalytic investment or the reimagining initiative in Somalia would ultimately try to do, which is how can we bring the private and the public sector together to sort of find out pathways that will scale up for the solution. And our target should be problems that are so prevalent, but also that can save lives. For example, we're talking about that data is a critical, especially humanitarian data. As you know, Somalia is now today going through again another humanitarian crisis that is putting millions of Somali under a huge food insecurity challenge, and some of it even facing extreme drought. So we're asking ourselves, given that the FuseNet and other data-led are now reducing their footprint and role, how can we step up to provide a data that is so reliable, but a data that the government of Somalia can make a decision upon? So this is exactly the very fundamental thinking of how we're thinking about this scale up. It's more about strengthening and building the institution, less about perpetuating and continuing the previous plans.
And is the data issue, is that well understood as a problem in Somalia, or do you think the attention this is getting is because people are so preoccupied with the food security problem? In other words, when you talk about this to your colleagues and to the Prime Minister for that matter, do you talk about it as a data intervention or as a food security intervention?
Well, I think it's a combination of both. It's a combination of both, because you need to understand what are because you have a set of different categorization. You cannot make an informed decision without having an understanding what are the real actual numbers. And as you know, the data, and this is like a people's data. People's life are on the line. It's not about a data of, a large set of data of, different documents and pronouns. It's about a people. So how do you make sure that the people how many people are suffering, and where and under which category they are? Then you can start mobilizing the resources. So the data part is very crucial, and it informs the interventions that we plan to undertake.
Well, it occurs to me in listening to you and listening to Simon that I think the world's going to be watching you, because when people think about fragile states, they think about Somalia. And when they think about Somalia and fragile states, they do not automatically think about data. They think about humanitarian feeding programs and things of that sort. You all are trying to take a step outside of that frame and saying, look, if we're going to do something significant about this on the humanitarian side, but also on the development side, we need to build the foundation, and the foundation, if I'm understanding correctly, requires information. So trying to do that means building a constituency around that and having people see enough value in the information that they're willing to do the things necessary to scale it and to sustain it. How are you going about building that constituency inside Somalia for the use of data and for building up robust data systems?
Well, let me clarify here. The foundation here is, first of all, the government of Somalia taking the leadership in its hand. That has not been the case for some time. Too often, whenever there's a humanitarian crisis happens in Somalia or countries with a fragility nature, often what happens is that solutions are being externalized, and you get countries that are coming and providing, an assistance based on their own readings, based on their own numbers, based on their own imaginations. What we are saying on the opposite here is, unless the government of Somalia takes the leadership role, the responsibility, then we will not be able to do anything at all. And when I say data, and the reason why we are emphasizing the data, it's not the most critical. Of course, the most critical part is people today who are suffering and facing acute drought that need an immediate assistance. And that is a part that also we separately engaged and doing to see how can we reach. But the conversation here is the longer term thinking here. And the longer term thinking ought to be, how do we ultimately, the government of Somalia makes its own decision based on its own analysis and based on its own facts, then it can triangulate the data and make an informed opinion decision. And I tell you why. It's also about strengthening institutions that will be critical in responding to the multitude crises that Somalia faces.
That's perfect. Simon, let me just ask you, just by way of closing, you mentioned in passing that your vision on scaling includes learning from Somalia and the other two cases to try and make this argument more broadly. Are you optimistic that there's an audience for that?
Yes, I mean, this is why I've involved experts from the scaling community of practice in this work. So as I mentioned before, the idea is to, at the pilot level, build in best practices and best insights coming from the mainstreaming insights, as well as all the rest of the work that the scaling community of practice has delved into over the many years that you've been leading it, and bringing those scaling experts in, not just one by one into each of the individual pilots, but as a team looking across the pilots. So we are expecting two scaling pathways then to come out of this work. One is, how do we do national scaling in those pilot countries, building off all the local leadership that Abdi Hakim and his government colleagues are showing, but also civil society, private sector, nationally and locally, and the same in the other two countries. But then what are we learning about this process of embedding scaling into addressing food and nutrition insecurity in fragile and conflict-affected locations so that we can scale out into other countries? And this is where I hope the contribution to the campaign is going to be coming through, maybe more towards next year rather than this year, because so much of what we're doing right now is building the building blocks for all of this work. But coming into next year, yes, very much so, Larry. I think there will be an audience. I think the traction we're already getting in this environment of financial scarcity is actually starting to open up the door for breaking down the silos that have inhibited collaborative action across from the humanitarian side to the development side to the resilience side. I think we're seeing, at least amongst certain leaders and certain institutions, a receptivity to say we've got to do things differently. That money isn't coming back. If we still want to achieve our mission, if we still want to achieve our institutional goals, new forms of collaboration, new forms of collective action, new forms of working together on strengthening data systems, strengthening information products into the hands of local stakeholders has to be at the heart of that. And that has to be through, different forms of collaboration in the future.
Well, can I put you on the spot and invite you back for next year to give us a progress report on how this is going?
If we are successful in what we're trying to do right now by, let's say, this time next year, Larry, is that what you're asking?
Yeah.
I would hope we will have launched the what we're calling the Big 10 Data Alliance that will bring these diverse stakeholders to be able to find each other more easily, collaborate more easily, work on system change more easily, as well as, individual initiatives around critical data sets that are the most needed by those local stakeholders, at least in the pilot countries. And we will have roadmaps in those pilot countries that are starting to be developed into engagement opportunities, as you inquired, earlier, around bringing in new financial resources, new funding partners, new investors, new collaborating partners, and so on, to strengthen those pilots at the very least. And back to something that Ndidi mentioned earlier, which I fully endorse, this has to be also positioned as communications, as advocacy, as influencing work into what's happening, for example, in the UN reform process, as well as the role that multilateral development banks, which are still much better resourced now than traditional bilaterals, what are they going to be doing around these kind of initiatives in the future, as well as new forms of philanthropy, new types of impact investors coming from non-traditional sources that say, we want to do things differently, we want to support things differently in the future. We're really interested in what you're doing.
Well, thank you very much. I hope the listeners understand why this is not only important in its own right, but I think a really perfect illustration of the kind of initiative that can not only take place under this campaign, but can really enrich the campaign along the way. Thanks, Simon. Thank you so much, Abdi Hakim. That was great. Let me bridge just to the last 5 minutes of today's session and say, a word or two about the way forward. This is the last 5 minutes, but in a way, it's the most important 5 minutes. As you will have taken from my remarks and everything that came after that, we're clearly at an inflection point in all this. If ever there was a time, it's now. If ever there were a need, it's probably now. But the exact right way forward remains a little bit foggy. And so we have a series of questions we'd like to ask you to help us with. This is not a kind of a rhetorical device. This is really where we are in the process. And so at this point, please, if you've had the hat on as a member of an audience, take that hat off and put on the hat of an active stakeholder right now and really think about the way forward and what you think would serve yourself, your organization, and the larger ends to best advantage. You'll find in the chat now a questionnaire. The questionnaire is something we'd like you all to fill out. We're going to be sending this around right after this session to the entirety of the community of practice, but it starts with you. And we're trying to take our cues because we really are a community of practice. We're taking our cues from the members. That's all of you and everybody else. We're going to have a session a week from Friday where we bring together the information that we've managed to collect into a conversation about where we go as a community of practice and what we can do collectively to most advance this campaign. So if you would click on the survey that you should find in your chat box now, you can do one of two things. You can either stay on the line right now when we end this conversation and fill it out. It shouldn't take you very long, but it's very important, and it will go straight into a database. You can fill it out after the session, and it will go into that same database, and or you can watch it when it comes around by email to you, click on it and fill it out, and it will go into that same database. We'll use that database as the foundation for the discussion a week from Friday and for our own planning going forward. As I said before, if this is really a movement and not simply a network, we need to find a way to get organized to do something important. And so it's not a joke. We don't need passive activity. We need active engagement. And so think about it from your respective points of view. Whatever it is that speaks to you, wherever it is you think you can make a contribution, assume the answer is yes. From our side, raise your hand, step forward, and we look forward to working with you in any way we possibly can. Thank you again to all the presenters in today's session for making it such a stimulating conversation about such an important topic. Bless you all. Bye-bye.